There are 3 ingredients needed to pass on an infection. The first one is a source of an infectious agent. There is a mode of transportation needed, and then there's also a susceptible host. There's 3 forms of the transmission for an infection. One is on contact, one is by droplet, and one is airborne. There are 7 forms of universal and standard precautions. One is hand hygiene. The other is appropriate use of gloves, use of facial protection, use of masks, gowns, or aprons, appropriate device handling, appropriate handling of laundry, and respiratory hygiene. There are 5 moments that us as healthcare givers should provide or be aware of in which hand washing should either occur before or after these things. It needs to happen before we touch a patient, before a clean or aseptic procedure, after body fluid exposure risk, after touching a patient, or after touching patient surroundings. The first thing you need to do is wet your hands with water. Then you have to apply enough soap to cover all of the surfaces of the hand. First thing is rub hands palm to palm, and it can be either way. Then you can take your right palm over your left dorsum with interlaced fingers and rub. And then vice versa. Then you go palm to palm with fingers interlaced, like so. Then you take the backs of the fingers to the opposing palm, like this, with the fingers interlocked. And then you do a rotational rubbing of left thumb, clasp in right hand, and then switch. Then you take your clasped fingers of your right hand and rotationally rub in the palm of the left hand, and then left hand. After this, you wash the hands off with warm water. You take a clean, dry agent like a paper towel and rub the hands till they're dry. You then use your towel to turn off the faucet. And now your hands are safe.